In the world of supplements, one of the most hazardous illusions is that because it is natural, it is safe. Today, we are dispelling one of the greatest offenders. You may get Garcinia cambogia in fat burners and detox tablets anywhere. The scary part is that many of you are taking Garcinia without realizing that it could be destroying your liver. I'm not being dramatic, but people have ended up in intensive care units and even required liver transplants after using it. Today, we'll discuss the warning signs, and most importantly, what you can do instead. Magic weight loss plans promise to reduce your appetite and melt fat without any effort, including how to use natural liver protection products like milk. Another supplement that protects your liver is thistle. What is Garcinia cambogia? It's a tropical fruit whose rind is used to make the supplement, and its main component is hydroxycitric acid, or HCA. Presumably, it inhibits the absorption of fat and decreases appetite by interfering with an enzyme called citrate lyase. That sounds fantastic, and I agree, but the problem is that your liver becomes overloaded when it tries to break this stuff down. The liver's function is to detoxify your blood, control your metabolism, and filter out the junk. A study published in the Journal of Medical Toxicology described a 34-year-old man who developed acute liver failure from using Garcinia. The damage was so severe that he ultimately required a liver transplant. Additionally, Australia's TGA, which is equivalent to the RFDA, issued a formal alert following multiple cases of severe hepatitis-like reactions from Garcinia-based supplements. HCA disrupts fat metabolism in the liver, which causes oxidative stress, inflammation, and in some cases, cell death. Now, let's discuss the dosing right, because it's not only about the supplement itself, it's also about how much you're taking, which is the theoretical safe zone for HCA. This isn't fringe science, this is a widespread concern. Garcinia contains less than 1,500 milligrams daily, however several over-the-counter. This is crucial if you have diabetes, high cholesterol, or chronic pain. Garcinia supplements contain 3,000 to 4,000 milligrams per day when you follow the label instructions, and some even go higher. This is not just pushing the line, that is crossing it every single day, and it gets worse with stacking. Many people are unknowingly doubling up on Garcinia because it is included in multiple products, such as your metabolism booster or fat burner. Moreover, some medications make this worse. So, what implications does this have for diabetes? Let's explore that. But first, a big thank you to those of you who've stuck with us this far. Creating these videos takes significant effort and dedication, so if you're enjoying the content, please hit the like button, subscribe to our channel, and share your thoughts on diabetes in the comments. Your support truly helps us grow. Now, let's get back to the video. There are common medications that intensify the effects of Garcinia on the liver. If you are taking any of these, you're putting gasoline on a fire. Statins, such as atorvastatin, simvastatin, or acetaminophen, such as Tylenol, are used to treat rheumatoid arthritis or psoriasis, and methotrexate is a more serious medication used for more serious anti-inflammatory conditions. Amiodarone, which is still fairly common and is used as a heart rhythm medication, and valproic acid, which is used to treat seizures but is less common these days, are all known to stress the liver. When you combine these medications with Garcinia, however, it's a perfect storm that puts your liver into overdrive, and most people don't realize it until it's too late. You owe it to yourself to get some baseline liver labs done if you're taking any fat-burning or detox supplements or are simply taking a lot of medications. Here's what to ask your doctor or the lab to check for you. Altin are liver enzymes that are extremely sensitive to even low-grade inflammation. GGT and ALP look at your bile duct stress. GGT is crucial because it rises above 15, which indicates that you have detox issues. Albumin is essentially the amount of protein your liver produces, and low levels indicate liver failure. Bilirubin is essentially how well your liver processes waste. If you start or stop taking any supplements that affect your metabolism, you should retest in 6 to 8 weeks. An INR indicates how well your liver is producing the clotting factors. Now, let's talk about how to support and protect your liver, and I'll tell you about a supplement that actually helps milk. One of the few herbal medicines with real clinical basis, thistle has been used for millennia to help detoxification and protect liver cells. Here's how it works. Silymarin, a flavonoid compound, stabilizes liver cell membranes and aids in the regeneration of damaged liver tissue. It has anti-inflammatory and antioxidant properties for your liver cells. It increases glutathione, your body's master antioxidant, which is used to treat alcoholic liver disease, non-alcoholic fatty liver, hepatitis, and even drug-induced liver damage. The usual dosage is 200 to 400 milligrams daily in divided doses. The highest I would go is a THOO. Now, look for products with 70 to 80% similar content. Not all milk thistle products will have this high concentration. If you are taking medication or are simply trying to maximize your liver resilience, milk thistle is not a license to take risky supplements or medications. Milk thistle is a wise, low-risk choice, in my opinion. Now, let me provide you some safer weight loss alternatives to Garcinia. Use 500 milligrams of berberine twice a day, for instance, as it is excellent for insulin resistance and metabolic syndrome. Dihydroberberine is even better for absorption. Green tea extract, particularly EGCG, at less than 300 milligrams daily, aids in fat oxidation without endangering the liver, and fibers like glucomannan found in konjac rice and shirataki rice slow down absorption, reduce appetite, and support gut health. Honestly, you will learn more about fat loss from regular glucose monitoring than any pill ever could. Consequently, consider CGMs as well. Here's the bottom line. Though it is natural, Garcinia can be harmful, particularly if you are using other medications or already have liver problems. If you have diabetes, fatty liver, or any other condition, weight loss is crucial, but you only have one liver, so don't blame it for a supplement that doesn't work. If you've used Garcinia, please share in the comments what brand you used, how long it lasted, and what happened. I'd also like to hear if you want some real support advice based on science. If so, hit the subscribe button. I have more coming. This is the exact kind of straightforward information your doctor should be giving you, but most likely isn't.